Did you know that over 780,000 Americans battle with Crohn's disease, a figure that continues to climb each year? Crohn's disease is a chronic inflammatory bowel disease that primarily affects the digestive tract. It can cause a range of symptoms from mild to severe, disrupting daily life and requiring ongoing management. Understanding Crohn's disease is crucial, not only for those directly affected, but also for their families, friends, and the medical community. The disease can manifest at any age, though it's most commonly diagnosed in adolescents and young adults. With the number of cases on the rise, it's more important than ever to grasp the challenges and complexities this condition presents. Despite its prevalence, many people are unaware of the significant impact Crohn's disease can have. It's a condition that doesn't just affect physical health, but emotional and social well-being too. Understanding Crohn's starts with recognizing its symptoms and how it presents itself in patients. Imagine having persistent gut pain that just doesn't seem to go away. That could be Crohn's. Crohn's disease is a chronic inflammatory condition primarily affecting the gastrointestinal tract. It presents a spectrum of symptoms that can perplex even the most astute observers. Today, let's delve into the typical clinical presentation of this complex disorder. The hallmark symptoms of Crohn's disease include persistent diarrhea, recurrent abdominal pain, and often unexplained weight loss. These symptoms don't just come and go, they linger, creating a constant battle for those affected. Diarrhea, not just your run-of-the-mill type, can be severe and debilitating, often accompanied by an urgent need to use the bathroom. This isn't just inconvenient, it's life-altering. Abdominal pain, another critical symptom, is typically located in the lower right area of the belly, yet it can be elusive, shifting its position and intensity. Imagine the frustration of dealing with pain that not only hurts but also hides, dodging treatments and explanations. Weight loss in Crohn's disease patients can be significant. Crohn's isn't just about stomach pain, it affects the body in multiple unexpected ways. When we delve deeper into Crohn's disease, the complexity unfolds with its broad spectrum of clinical manifestations. Not only does it impact the gastrointestinal tract, but the repercussions can ripple through the entire body, manifesting in various severe complications and systemic symptoms. One of the most common complications is the formation of strictures. This occurs when chronic inflammation causes a segment of the intestine to become narrowed, which can lead to blockages and require surgical intervention. Equally challenging are fistulas, which are abnormal connections that can form between the intestine and other organs or the skin. These can lead to significant discomfort and are prone to infections. Abscesses, another serious complication, are collections of pus that can accumulate in the abdominal cavity due to the ongoing inflammation. These pockets of infection not only cause severe pain, but can also lead to further systemic infections if not promptly managed. Beyond the confines of the gut, Crohn's disease can trigger systemic symptoms. Fever and fatigue are frequent, reflecting the body's ongoing battle against inflammation. Anemia is also prevalent, often as a result of decreased iron absorption or loss of blood during bowel movements. These symptoms collectively contribute to the overall decline in a patient's quality of life. Moreover, Crohn's isn't limited to affecting just the digestive system. It can also lead to complications in other parts of the body. For instance, inflammation can spread to the eyes, resulting in conditions like uveitis, which can cause eye pain and blurred vision. The skin may develop erythema nodosum, characterized by tender red nodules, usually on the lower legs. Joint pain, particularly in the larger joints like the knees and elbows, is another common complaint, complicating mobility and daily activities. The diverse manifestations of Crohn's highlight the complexity of this disease, affecting more than just the digestive tract. This intricate interplay of symptoms underscores the necessity for a comprehensive approach to diagnosis and management, ensuring that treatment addresses both the intestinal and extra-intestinal facets of Crohn's disease. Diagnosing Crohn's involves more than just symptom checking. It requires concrete evidence from lab tests. When doctors suspect Crohn's disease, a series of laboratory tests are pivotal in confirming the diagnosis. and understanding the extent of the condition. One of the primary blood tests includes checking for inflammation markers such as C-reactive protein or CRP and erythrocyte sedimentation rate, known as ESR. Elevated levels of CRP and an increased ESR suggest the presence of inflammation, which is a hallmark of Crohn's disease. These tests, while not specific to Crohn's, are useful in assessing the intensity of the inflammatory response within the body. Another crucial blood test looks for signs of anemia, a common issue in Crohn's patients, caused by decreased iron absorption or chronic intestinal bleeding. This test measures hemoglobin and hematocrit levels, indicators that can significantly impact the patient's energy levels and overall health. Moving beyond blood tests, stool tests play a significant role. These are used to exclude infections that mimic Crohn's symptoms and to detect calprotectin or lactoferrin, proteins found in the stool that indicate intestinal inflammation. Elevated levels can corroborate the suspicion of Crohn's disease. For a definitive diagnosis, imaging tests are indispensable. A colonoscopy allows direct visualization of the intestinal mucosa and the opportunity to obtain biopsies. These tissue samples are examined microscopically to identify the characteristic patterns of inflammation and cellular changes unique to Crohn's disease. These lab tests are vital for not only diagnosing Crohn's but also for monitoring its progression and response to treatment. So, what have we learned about Crohn's disease today? We've unpacked the clinical presentation of this condition, highlighting the diverse symptoms that can vary widely among individuals. We've also explored the broader clinical manifestations, which can impact multiple body systems, illustrating the complexity of this disease. Furthermore, we delved into the crucial role of laboratory findings, which are indispensable for accurate diagnosis and effective management. Awareness is key, and understanding Crohn's disease is the first step towards effective management and support for those affected.